What is the psyche of people with psoriasis? Because if there's going to be new treatment that's so good, does everybody come, and how do they feel? I always think of people really hiding themselves.
Right. Well, and that's why I was glad that you asked me to talk about psoriasis today, because psoriasis has been recognized now as I mentioned, kind of a multi-system disease. It does certainly affect the skin and joints, but turns out, like other inflammatory diseases, that inflammation is being more and more associated with other problems. So as you're probably familiar with, a lot of inflammatory diseases, we're talking about increased risk of heart disease primarily. So it turns out that if you have moderate to severe psoriasis, that your risk of having a major cardiac event is actually 58% higher than a person of similar age and sex that does not have psoriasis. So very significant.
So it's a wake-up call.
It really
for
is.
People that have psoriasis, that you need to be sure that your heart markers are in good shape, cholesterol, blood vessels, that sort of stuff.
All of that, 43% increased risk of stroke. It's been associated with what's referred to as metabolic syndrome, which are people who tend to be obese, tend to have high blood pressure, may have type 2 diabetes, with those people. So all of that goes along with having psoriasis, and it's probably this inflammation connection that's being found.
Wow, so the message right now is, if you've got psoriasis, you may have these other problems that we need to work on, or if we work on these other problems, it may help psoriasis?
Well, it does tend to cluster in people with more moderate to severe disease. So remember, if you just have a little patch on one elbow or a small patch on the back of the scalp, that's referred to as mild psoriasis when it's under 3% of the body surface area. So when we get between 3 and 10%, this is moderate, and above 10% severe. So as we're getting into those bigger numbers and more effect on the skin, that's a marker for these elevated risks. And then you asked about psyche, and certainly it turns out that patients with psoriasis also have a much higher rate of depression. Okay, and the question becomes, is that endogenous or exogenous? And what I mean by that is, do those chemicals rolling around in their body in that inflammation state actually produce the depression itself, or is it just the quality of life of the psoriatic that is really, causing the depression?
Do we know the answer on that? Because certainly if somebody has severe psoriasis, they may not want to get out and see people, and they may get depressed. Or how do we know?
Well, I don't know that you can divide it. You just know that it is certainly a characteristic. And we do know that people with psoriasis who fill out quality of life surveys, these are a tool that are used to assess the degree to which many different health issues impact quality of life. And if you look at the score that people with severe psoriasis give, it's the same score as people with blindness.
Wow. Wow.
Yeah.
So quality of life in people with psoriasis is the same as if you were blind.
That is how they feel.
And it's associated, you said, with maybe depression, maybe obesity, maybe metabolic syndrome, maybe heart disease, strokes. That's really big time. Is that new findings? Sort of?
These are relatively new findings, and so if your dermatologist hasn't gone into this with you, this is fairly new information, especially, we're trying to get at some of the psoriatics who are out there who maybe saw their dermatologist 10 or 15 years ago, were given a few creams that they didn't really find very effective and have sort of given up. So that patient really needs to be aware that there are these new bits of information out there that really impact their need to go ahead and seek therapy.